most. I feel like there should be a common there. But we're going to identify potential weak links. So what in that movement, what muscles may be saying, hey, I need to be strengthened? And what muscles are saying, hey, I need to be lengthened? So this is where really specificity comes in these exercises. And that's where I nerd out, particularly, if you can't tell. All right, so then we're going to check our AT. You're going to check your alignment and you're going to check your tension. These two things are the quickest way to make change, to change pain and further identify what areas need strengthening most. So I went over a couple. We're going to go over a few in this next slide. Okay. So your simple shift 1, this is an example of walking. So remember I said when I would experience that sharp pelvic pain, it was when I would notice I was leaning back and my foot was jutting out forward. So this simple shift you're going to make is tits over toes, TOT. So shifting your rib cage forward. You see how in this first photo, my boobs are way back, my belly's way out, and my heel is striking down here on the ground. So from a movement mechanics standpoint, when you're jutting that knee out front, it's going to put all of that pressure right up the chain, and that can go right into that pelvic bone, especially when you've got that extra weight of the baby that you're carrying. And you can see here that my baby was fairly low. She was way down in there in my pelvis, and it was not comfortable. So this simple shift that you're going to make, the tits over toes. So now you can see my chest is a little further forward and I'm actually landing with my breasts right over my toes. So this is going to reduce that impact from the heel down. It's going to place all of your weight over your front foot. So kind of dampening that blow, if that makes sense. I hate to say it that way because it's not like walking is a blow to your body, but you know, it's making it a little more like the bed of nails. It's making that surface area a little bit bigger. So this is your simple shift number 1 that I want you to try to help you walk without crotch pain. And then the second one, this a simple shift you can make to reduce back and rib pain. So in this first picture, you can see that my rib cage is way out. Nipple trajectory would be to the ceiling. And then my butt, like my back is real arched here. So everything is just kind of arched and my belly is extended forward. Knees are locked here as well. So in this simple shift number 2, I call it the bell over bowl. So you've got your bell on the top and then your bowl is your pelvis. Bell is your rib cage, bowl is your pelvis. Currently in that first picture, my bell and my bowl are like this. This shift is going to bring bell and bowl right over each other. And as you can see here, it seems like I have more core control in my belly, right? There's a very noticeable difference. Rib cage is down, nipple trajectory is more out forward. And then you can see my glutes are unlocked a little bit as well. And that's part of the tension thing. So when it comes to tailbone pain, pelvic pain, really all the pains, we want to be looking at what tension do we have in the muscles, and particularly here in the glutes, especially when we're talking about pelvis. Are you clenching your glutes and holding your glutes really tense during the day? I am a guilty glute tensioner because that can actually shorten the pelvic floor. And when we shorten the pelvic floor, when the pelvic floor is held tight, your pubic bone and your, here, let me get my pelvis model. That would make more sense. Okay. Excuse her, she's got a wonky hip. Okay. Tailbone, pubic bone. So if your glutes are held really tight, chances are that your pelvic floor is going to be shortened a little bit because it's going to tuck your tailbone under. So it's going to shorten this range from tailbone to pubic bone. So you can see if you've got tailbone pain or pubic bone pain, that lengthening this out would reduce the pressure on both of those points. If you can see that and if that makes sense. So there's often a really super simple shift that you can make to change the way that a movement feels right in the moment. Okay. Any questions so far? I know I've like gone through a whole bunch of information in not very long, not a very big amount of time. Okay. Let's take a mindfulness minute. Some of the most often recommended tools are bands, belts, kinesia tape, other tools to kind of hold the belly up to reduce pressure on the pelvis and on the pelvic floor. And they can be really useful. In fact, I used the BioBay Active Wear band when I worked out during my third pregnancy, and it was very helpful for reducing pressure on my pelvic floor. And you got to make sure that you have one that's a little bit more compression, that holds that belly up a little bit better. Not all bands and belts are made the same. But the most effective way to reduce pain and symptoms is by unlocking the power of your own body, by getting to know your tendencies, by looking at your alignment and your tension, and then looking at your movement currently. What movements are you currently feeling pain in? What ranges of motion are limited? These are things that we want to look at, because in the end, introducing variety and introducing strength into the muscles, as well as specific stretches and mobility exercises, that's where the change happens. So many things are happening to your pelvis, and your muscles are changing as well. So keeping your muscles strong in ways that don't exacerbate the pain, that's the best way to support your pelvis and your body as these big changes happen.